Hello everyone. In this video, I'll be mentioning the important points of upper limb anatomy which you can use for quick revision after reading from your notes or add some points to your notes if it is helpful. So first of all, muscles of the rotator cuff. Its mnemonic is SITS, subscapularis, infraspinatus, teres minor and supraspinatus. They usually ask about the actions of the muscles. So subscapularis will do medial rotation, infraspinatus and teres minor will do lateral rotation, and supraspinatus helps in abduction from 0 to 15 degrees. Now let's talk about the abduction of the shoulder joint. In abduction, they ask about from 0 to 15 degree, its supraspinatus is involved. 15 to 19 degree acromial fibers of deltoid are involved, and more than 90 degree we have serratus anterior and trapezius. They ask about the nerve supply of serratus anterior, and it is long thoracic nerve, which you can remember from the mnemonic SALT. Now the next important point is structures pierced. Clavipectoral fascia is pierced by which of the structures, and you need to remember it by call, like C for cephalic vein, A for artery which is thoracoacromial, L for lateral pectoral nerve, and L for lymphatics from the breast. Now they ask the various names of the muscles. So one is the boxer's muscle, which is known as serratus anterior. Swimmer's muscle is latissimus dorsi, and shrugging muscle is trapezius. Now arteries are divided by which of the muscles? So remember, axillary is divided by pectoralis minor, subclavian is by scalenus anterior, maxillary is by lateral pterygoid, and lingual is by hypoglossus. Now branches of axillary artery, remember it has three parts, and first part give one branch, second part give two branches, and third part give three branches. The mnemonic is screw the lawyer, save a patient. S for superior thoracic, T for thoracoacromial, L for lateral thoracic, S for subscapular, A for anterior circumflex, and P for posterior circumflex. So in this way you can remember the axillary artery branches. Now one question is like scapula anastomosis. It occurs between first part of subclavian and third part of axillary artery. Now brachial plexus. Remember the mnemonic, really tired, drink coffee now. Like first it has roots, then the trunks, then trunks give divisions, then we have cords, and then the nerves. Remember, roots, trunks and divisions are suprascapular, cords and nerves are supraclavicular, and cords and nerves are infraclavicular. Then we have, if there is upper trunk involvement, then it leads to Erb's paralysis, and lower trunk involvement leads to clump case paralysis. Now remember, wrist drop is due to radial nerve involvement, and ape thumb deformity is median nerve involvement. And do see the diagram of cutaneous nerve supply of hand, and remember, musician's nerve is the ulnar nerve and laborer's nerve is the median nerve. Then we have axillary nerve, which is known as the surgeon's nerve. Remember the type of joints. One is sternoclavicular, which is saddle joint, then intermediate radioulnar joint, which is fibrous joint. It is one of the previous year INI set question. Then superior and inferior radioulnar joint is pivot type, and first carpometacarpal joint is saddle joint. And remember, ulna is not involved in wrist joint formation. It is previous year AIMS question. Then talking about the carpal bones, largest is capitate, boat shape is scaphoid, and moon shape is lunate. Then the dermatome of thumb is C6 and little finger is C8. Then the nerve supply of median nerve supply is the following muscles, which is loaf: first and second lumbricals, opponens pollicis, abductor pollicis brevis, and flexor pollicis brevis. And rest all the muscles of the hand are supplied by ulnar nerve, and it passes between two heads of pronator teres. Then remember the mnemonic pad and dab. Palmar interosseae are for adduction and dorsal interosseae are for abduction. There is a question like palmar interosseae are not attached to the middle finger. Then let's talk about the extensor retinaculum. There are 6 compartments. I know ये देखने में मुश्किल लगता है, but it is very easy to learn. बस ऐसे याद रखना कि 6th compartment है, and 6th one we have the ulnar bone, so the muscle will be extensor carpi ulnaris. And on the ulnar side we have a little finger, so 5th compartment will be extensor digiti minimi. Now the first 3, remember like this, these are involved with anatomical snuff box formation. So first compartment, the lateral boundary of the anatomical snuff box is the first compartment of extensor retinaculum, that is abductor pollicis longus and extensor pollicis brevis. And second one is the floor of the anatomical snuff box, like extensor carpi radialis longus and extensor carpi radialis brevis. And third is the extensor pollicis longus, which forms the medial boundary of the anatomical snuff box. And then we have the fourth compartment, which have 4 structures: extensor digitorum, extensor indicis, posterior interosseous nerve, and anterior interosseous artery. This is very important. And do see the images of spaces around the arm. Thank you. Kindly like, share and subscribe. I'll share the PDF of this in my Telegram channel. The link is given in the description box, and in next video we'll be posting more points related to anatomy.